Thank you for joining us to discuss this exciting integration of Anytime Pediatrics telehealth platform with the Office Practicum electronic health record. I'm Sue Cressley, Medical Director for OP, and we appreciate your time and interest. While the COVID-19 pandemic may have sparked the robust uptake of telehealth in order to care for patients during challenging times, by no means is telehealth a solution we can expect to only use during times of crisis. Successful practices will make telehealth an integral part of their care offerings. Patients and families will continue to demand care delivery via telehealth for multiple reasons, including safety, convenience, and a true added value for their family. If practices don't find a way to deliver care using this technology, families will find another venue to access these services. More importantly, innovative practices who look for ways to meet their families where they are, to provide the care they need, will position themselves for continued success. We should not be asking ourselves why, but instead, yes, and what else can I do to create increased access which is valued by our community? Success will depend on sustainable workflows that include a clear vision of telehealth practice offerings. In addition, a solution which integrates the telehealth platform with the EHR is important for streamlined care delivery. Let's take a brief look at the Anytime Pediatrics telehealth offering. Anytime Pediatrics offers a HIPAA-compliant platform which is important for care delivery beyond the public health emergency. It has a virtual waiting room where your staff can interact with patients in the same way they might do in your office. In addition, the feature where parents can upload photos securely aids in visual diagnoses. Anytime Pediatrics is a flexible solution, allowing practices to customize their telemedicine workflows based on unique needs. Most practices get started with pre-scheduled visits and consultations during normal business hours, and later expand virtual care offerings for after hours and/or walk-ins. Anytime Pediatrics is more than a telemedicine platform. It's a supportive community that includes live clinical, administrative, and on-demand user training, landing pages, social media posts, brochures, email templates, and family engagement materials, and weekly tips and tricks, videos, resources, and customer support. So let's take a look at the first offering for integration between OP and Anytime Pediatrics. Appointment scheduling integration offers a solution for the majority of practices who start with scheduled telemedicine appointments. The integration allows for scheduling of telehealth appointments in the Office Practicum calendar schedule, along with in-person and other types of appointments. This allows provider schedules to be coordinated. OP then pushes the scheduled appointment to the Anytime Pediatrics platform, eliminating the need for staff to schedule appointments in both platforms. For patients who have already been seen or have an account in the Anytime Ped system, the appointment simply is pushed over and available for the family to log in at the appropriate time. Confirmation of telehealth appointments are supported as part of the practice's current OP confirmation workflow. For patients who are not yet registered at Anytime Pediatrics, workflow is based on the family contact email, which is pushed to Anytime, and the parent receives an invitation from Anytime Pediatrics to enroll. Let's take a closer look at scheduling. While working inside Office Practicum to schedule appointments in the calendar schedule, it is important to note that an appointment type to support the integration must be made. If we go to our appointment types and zones, which is on the Practice Management tab of Office Practicum, you will want to create appointment types, visit types, and description that are hooked to the purpose of telehealth encounter. You can call the types and descriptions whatever you want, but for it to be pushed to Anytime as a scheduled telehealth encounter, the purpose of the appointment must be telehealth encounter. So for example, you might want to call this a telemedicine established, a virtual new, an extra time for those complex appointments. In addition, by doing that, you will be able to alert your schedulers the default duration of that appointment, which you want hooked for every visit. And it can also be for sick and well visits if you're performing well visits in your practice for telemedicine. In addition, you're going to want to go to your telemedicine symptom templates, or those which your office team will use to schedule appointments, and use one of those appointment types that are part of your telemedicine offering. For this telemedicine symptom template of fatigue, you may want to make sure this is extra time, since we know fatigue often is complicated, and that will give you 30 minutes to do so. In addition, you're going to want to make the default place of service telehealth, and that automatically will route for billing appropriately. Also, you may have included any wording in your templates that's appropriate for telehealth, which your payers want documentation. So if we go to the schedule and we make our patient a telemedicine fatigue symptom template, because we're going to have this patient be seen at 2 o'clock, you will notice a few things. The appointment type came with the symptom template, and if you don't use the template, you can choose these appointment types. If you do use a template, or the appointment type is hooked to a certain duration, it will be hooked here. And because this practice already has an integration with Anytime Pediatrics, the telehealth vendor populates as Anytime Pediatrics. When you save that appointment, Office Practicum will then push that appointment for 2 p.m. to the Anytime Pediatrics platform, so that the patient can log in and claim that appointment, and you can see it in your waiting room. When you open that appointment as a provider, you will get that same template that you're used to seeing within the Office Practicum application. Because that appointment was scheduled within Office Practicum with the integration features and functionality, when the parent goes to log on and chooses their child, they will notice that that appointment was scheduled for 2 p.m. and will be available closer to that appointment time. No longer will practices have to schedule the appointment both inside of OP and within the Anytime Pediatrics platform. So let's review the key scheduling points within OP. The visit appointment type purposed must be telehealth encounter. Practices can name the visit type and description according to their preferences, as long as that purpose is telehealth encounter. And we encourage you to add the appointment type to templates so that schedulers have default appropriate telehealth designation for billing, including place of service, as well as appropriate default time for telehealth visits. Nobody likes to log on to multiple platforms to deliver patient care. So let's move on to single sign-on. Single sign-on allows users who have both an OP login and an Anytime Pediatrics login to navigate directly to the Anytime Pediatrics platform from inside Office Practicum. The Anytime Pediatrics Access icon is available from 3 key areas within OP to support your workflow. These include from the Clinical tab, located between the Document Management and Medical Records, on the top toolbar of any encounter note in progress, and on the top toolbar of any well visit note in progress. Let's take a closer look at single sign-on. From inside Office Practicum, you will notice the Anytime Pediatrics icon, which is up in the Clinical tab workflow. And at any point with any patient in any context, you can just click on the Anytime Pediatrics icon and it will navigate you to already logged in with your OP to Anytime integration to the waiting room of Anytime Pediatrics. You can then navigate as you normally would within that platform to get anywhere you would like to go. In addition, if you're in the middle of opening that note on telemedicine fatigue that you started, you can click the icon in the corner of the visit, which will also log you into the same place. Similarly, if you had a well visit, that icon would be at the top toolbar of the well visit for easy navigation. Thank you so much for your time and attention. We know you will be as excited about the integration of Anytime Pediatrics with Office Practicum as we are. Working together, we can be sure to meet our families where they are to provide the care they need.